Hello, my friends. Welcome back to the channel. I'm Dr. Anna Schneider, your friendly back pain warrior with over 20 years of experience helping people just like you reclaim their lives from the grip of that nagging, stubborn ache in their backs. Today, we're diving into something I know you've been curious about: over-the-counter medications for back pain. If you've ever stood in the pharmacy aisle, staring at a wall of pill bottles, wondering, which one's going to help me stand tall again? This is for you. Picture this: you wake up, the sun's shining, and you're ready to conquer the day, but then, that familiar twinge hits. Your back says, "Not today, buddy." Sound familiar? I've been there, well, not personally, but through the thousands of patients I've walked beside on their journey to freedom from pain. And here's the truth I want you to hold on to: you are not powerless. You've got options, you've got strength, and today, I'm handing you the tools to take back control of your body. So, grab a cup of tea, or coffee if you're feeling bold, settle in, and let's unpack this together. We're talking science, practical tips, and a big dose of encouragement, because you deserve to feel proud of every step you take toward healing. Oh, and stick around to the end, I've got a little challenge for you that'll spark some serious motivation. Let's do this. Let's start with the elephant in the room: why does back pain feel so personal? I mean, it's not just a physical ache, it's like your own body's staging a rebellion against you, right? As a doctor, I've seen this over and over. Patients come in frustrated, exhausted, and honestly, a little heartbroken. And I get it. Your back is your foundation. It's what holds you up, literally and figuratively. When it hurts, it's not just your spine complaining, it's your confidence, your energy, your life taking a hit. But here's the good news: that rebellion? It's not permanent. Science backs this up: your body wants to heal. It's built to recover, to adapt, to thrive. And over-the-counter, OTC, medications? They're like the trusty sidekicks in this epic comeback story. They're not the whole solution, spoiler alert, we'll talk lifestyle changes later, but they can give you that first push to stand taller, move freer, and feel like you again. So, what do you think? Have you ever felt like your back pain was holding you hostage? Drop a comment below and let me know. I'm reading every single one, because your story matters to me. Alright, let's get into the nitty-gritty. When you're staring at that pharmacy shelf, you're usually looking at three main heroes: acetaminophen, ibuprofen, and aspirin. Maybe you've heard of naproxen too. It's ibuprofen's slightly sassier cousin. These are the heavy hitters in the OTC world, and each one's got a unique superpower. As a doctor, I prescribed these, studied them, and seen them work wonders, so let's break it down like we're old friends chatting over coffee. First up, acetaminophen. You might know it as Tylenol. This one's all about pain relief. It works in your brain to dial down the ouch signals your back's sending. Scientifically speaking, it inhibits something called prostaglandin synthesis in the central nervous system. Fancy words, I know, but it just means it tells your brain, hey, chill out, it's not that bad. It's fantastic for mild to moderate back pain, especially if inflammation isn't the main culprit. Think muscle stiffness from sitting too long or a little tweak from gardening. But here's the catch: it's not an anti-inflammatory. So if your back's swollen or hot, like after a big workout or an injury, it might not tackle the root cause. And please listen to this: stick to the dose on the bottle. Too much acetaminophen can stress your liver, and I want you thriving, not sidelined. Next, ibuprofen. This is your Advil, your Motrin, the inflammation fighter. It's what we call an NSAID, non-steroidal anti-inflammatory drug. It blocks enzymes called COX-1 and COX-2, which are like the troublemakers pumping out prostaglandins that cause pain and swelling. So if your back's aching because you overdid it at the gym or slept funny on a lumpy mattress, ibuprofen's your gal. It's a double whammy: pain relief and calming that angry inflammation. Quick tip from my years in the clinic: take it with food. It can be tough on your stomach otherwise, and trust me, you don't need a tummy ache on top of a backache. Aspirin's up next. It's another NSAID, so it's got that inflammation busting power too. It's been around forever. Think of it as the wise grandparent of pain relief. It works similarly to ibuprofen, but it's got a bonus: it thins your blood a little, which is why it's famous for heart health. For back pain? It's solid for mild flare-ups, but it's not my go-to because it can irritate your stomach more than ibuprofen. And finally, naproxen. Aleve is the brand you'll see. It's like ibuprofen's longer-lasting sibling. It sticks around in your system for up to 12 hours, so you're not popping pills all day. Perfect if your back pain likes to linger. Same NSAID rules apply. It's great for inflammation, but protect that stomach with a snack. Now, here's a question for you. Which of these have you tried? Did it work, or maybe not so much? Share your experience in the comments. I'm dying to hear what's worked for you. Okay, so we've got the lineup, but how do you pick the winner for your back? This is where my decades of experience come in, and I'm so excited to share this with you. Because here's the thing, you're not just a patient to me, you're a teammate. We're figuring this out together. Step 1. Ask yourself, what's driving my pain? Is it a dull, nagging ache? Maybe acetaminophen's your starting point. Is it sharp, with stiffness or swelling, like your back's throwing a tantrum? Lean toward ibuprofen or naproxen. Aspirin's an option too, but I usually save it for folks who tolerate it well and don't mind the shorter relief window. Step 2. Know your body. If you've got a sensitive stomach, NSAIDs might not be your best friend. Stick to acetaminophen and talk to your doc if you're unsure. If you're on other meds, like blood thinners, skip aspirin and check in with a healthcare pro. Safety first, always. Step 3. Timing matters. If you need quick relief for a few hours, like to get through a work meeting, ibuprofen's fast-acting. If you're in it for the long haul, like a full day of errands, naproxen's got your back, pun intended. Here's what I tell my patients: start low, go slow. Follow the label, don't overdo it, and give it a fair shot, about 20 to 30 minutes, to kick in. And if it's not cutting it after a couple days? That's your cue to call your doctor. You're worth more than guesswork. What's your go-to when your back acts up? Pop it in the comments. I'd love to know what's in your toolkit. Now, let's zoom out for a sec. These OTC meds? They're awesome for a quick win, and I mean that. I've seen them turn days around for my patients. But here's the real talk: they're a bridge, not the destination. Back pain isn't just a pill problem, it's a you problem, in the best way possible. What do I mean? Your body's telling you something. Maybe it's, hey, you've been slouching at your desk for 8 hours, or remember that time you lifted that couch like a superhero? Medications can quiet the noise, but the real power comes when you pair them with movement, rest, and strength. Think about it: a strong core, a good stretch, a walk around the block. These are your superpowers. I've had patients who started with ibuprofen to get through the day, then added a 10-minute stretch routine and cut their pain in half. That's not just science, that's you taking the reins. So, here's a little nudge: next time you reach for that bottle, pair it with one small win. Stand up and stretch. Roll your shoulders. Breathe deep. You're not just medicating, you're healing. How does that sound? What's one tiny habit you could add to your routine? Let's brainstorm together in the comments. Alright, my friends, let's talk safety, because I care about you too much to skip this. OTC meds are accessible, but they're not candy. I've seen folks in my clinic breeze past the fine print and end up with headaches, figurative and literal, so let's keep you in the clear. Acetaminophen, max out at 4,000 milligrams a day. Check every label, because it hides in cold meds too. More than that? Your liver's waving a red flag. Ibuprofen and naproxen, stick to the dose, usually 200 to 400 milligrams every 6 to 8 hours for ibuprofen, 220 milligrams every 8 to 12 for naproxen. Overdo it, and your stomach might protest, or worse, your kidneys could take a hit. Aspirin, same deal, follow the bottle. And if you've got ulcers or bleeding issues, steer clear unless your doc says otherwise. And here's my golden rule: If you're popping these daily for weeks, it's time to talk to someone. Chronic pain's a signal, not a lifestyle. You deserve answers, not band-aids. Quick poll, have you ever read the whole label on a med bottle? Be honest, yes or no in the comments. Okay, let's pause for a pep talk, because you need to hear this. Back pain doesn't define you, it's just a chapter, not the whole book. Every time you choose the right med, stretch a little longer, or say no to that extra couch lifting gig, you're writing a victory. I've seen patients go from hobbling into my office to hiking trails, dancing at weddings, chasing grandkids, all because they refuse to let pain call the shots. That's you I'm talking about. You're stronger than you know, and every step, every single one, is proof. So stand up with me, literally, right now if you can. Roll those shoulders back. Take a deep breath. Feel that? That's your power kicking in. You're not just surviving back pain, you're mastering it. How does that feel? Tell me in the comments, I'm cheering you on. Well, my friends, we've covered a lot today: acetaminophen, ibuprofen, aspirin, naproxen, and a whole lot of hope. You've got the science, the strategy, and the spark to take charge of your back pain. I'm so proud of you for being here, for investing in yourself. Here's my challenge: try one tip from today, whether it's picking the right med or adding a stretch, and let me know how it goes. Drop a comment below with your story, and while you're at it, tell me where you're watching from, your city, your country, wherever you are in this big, beautiful world. I want to give you a shout out next time. If this helped you, smash that like button, subscribe if you haven't, and share it with someone who needs a little back pain TLC. We're a community here, and I'm with you every step of the way. Until next time, keep standing tall, you've got this. I'll see you in the comments.